Today, one of my students will take over this video. She is a doctor in training, and she will help me with this channel. She will cover more of the questions that come from all the men watching. Lexi, the word is yours.
Hi, I'm Dr. Lexi Truthstone, a doctor in training. Did you know that the complaint I hear most from men is that they feel like they're getting smaller down there as they age? Like their body is shrinking when they want it to feel full and present, and that it takes much more time to get hard. But it's an easy question for me, since you can wake this process back up, and in the next 10 minutes I will tell you exactly how, so keep listening. Hi, welcome to this channel. I'm Dr. Lexi Truthstone, a doctor in training. I love to cook and to dance, so this channel fits me perfectly, because in the end I will give you a recipe that, together with the tools I will explain, will make sure you're booming tonight again, just like when you were young. I want you to imagine something with me. You're standing in front of a mirror. The room is warm. You look down and see more than you've seen in years. More length, more confidence. That's not fantasy. That's what the combination I'm about to give you can do. More than 3/4 of an inch of real measurable growth. Now if you're feeling that little pulse of excitement right now, that warmth spreading through your chest thinking maybe this is actually possible, do me a favor, hit that like button. I'm still building my confidence putting these videos out there, and every like tells me you want more of this. That you're ready to hear what really works. Here's what I discovered in my training that changed everything. Researchers surveyed 50,000 men about how they felt about their size. More than half said they weren't satisfied. But when those same researchers asked the partners of those men, 85% of women said they were completely happy with what their partner had. So the dissatisfaction isn't coming from your bedroom. It's coming from somewhere else. Comparisons. Unrealistic expectations. The way bodies change over time. And you start wondering if you're still enough. And I want to hear from you. Comment below with your age and where you're watching from. I'm curious to know who's on this journey with me. And if you haven't subscribed yet, hit that subscribe button so you don't miss the next videos where I'll be sharing more recipes and techniques for men's health. But here's what surprised me when I was studying this. There's actually a medical term for what happens when this dissatisfaction takes over your life. It's called small penis anxiety. And it's not a joke, it's a real form of body dysmorphic disorder that can completely change how a man lives. I learned about this in one of my lectures, and the professor described men who spend more than an hour every single day thinking about their size. Not just a passing thought, an obsession. Some men avoid intimacy entirely because they're convinced they're not enough. Some avoid relationships. Some end up so distressed they need hospitalization. This isn't about vanity. This is about men who look in the mirror and see something completely different from what's actually there. And the worst part is, when you talk to their partners, those partners are usually confused. They had no idea their man was suffering like this. Because the problem isn't in the bedroom, it's in his head. And a lot of this comes from what men are seeing online. Pornography has completely warped what normal looks like. You're comparing yourself to men who were specifically chosen because they're in the top fraction of a percent. That's like comparing your body to a professional athlete and feeling bad that you don't look like that. Of course you don't. Most men don't. But here's what confused me when I was learning about this. If the problem is psychological, if it's all in your head, then why do some physical treatments actually work? Why can some men actually see measurable growth? The answer is in how your body responds to pressure, to stretch. When you create consistent mechanical traction, your body reads that as a signal to build new tissue. And that's exactly what surgery tries to do. When surgeons want to create length, they cut the suspensory ligament. That's the ligament holding your penis to your pubic bone. When they release it, you get more visible length because it's not being held as tightly to your body anymore. Some procedures use grafts, flaps, even rib cartilage to try to add even more. And here's what clicked for me when I learned this. Surgery is trying to create one specific effect: mechanical stretch. Gentle, consistent pulling that signals your body to build new tissue. That's it, that's the entire goal. But you don't need surgery to create that stretch. You can do it another way, with traction. And when you do it right, your body responds the exact same way. New tissue, real growth, the same result without any cutting. Now I'm bringing up surgery because if you search online for how to get longer, surgery is going to be the first thing you see, and the outcomes are devastating. I saw case studies of men who ended up with complications, disfigurement, scar tissue that made everything worse. Some lost function entirely. Men who went abroad for cheaper procedures came back with infections and permanent damage. The medical society that oversees sexual medicine states these procedures are not recommended unless you're in a clinical trial, or you have a rare medical condition affecting less than 1% of men. So surgery creates the right effect, but the risks destroy lives. The method I'm giving you creates that same mechanical stretch without a scalpel. And when you add the internal support I'm going to teach you, your body responds even better. Here's what shocked me most when I was studying this. There's one treatment that worked better than surgery, better than any device, better than anything physical. And when I saw the data, I couldn't believe it. Psychological counseling. Stay with me on this because the numbers are incredible. When researchers tracked men who went through counseling specifically for anxiety about their size, the majority of them stopped looking for any other treatment. Completely stopped. They didn't want surgery anymore. They didn't want devices. They were done, just from talking to someone who helped them see what was actually there. And here's why that works. Remember that survey? 85% of partners were already satisfied. The gap wasn't in the bedroom. It was in the mirror, in the comparison, in the fear that you're not measuring up to some standard that doesn't even exist in real life. Counseling closes that gap. It rewires how you see yourself. And for a lot of men, that's all they need. The relief is immediate. The anxiety melts away. And suddenly intimacy feels different, because you're not performing against an imaginary standard anymore. You're just there, present, confident. But here's where my professor said something that changed how I understood all of this. Some men need more than conversation. Their bodies actually can change. And there's one method that's been proven to work in studies. Real growth, measurable results. The thing is, this method only works when you combine it with a specific drink. A recipe I'm going to show you how to make. But you have to use it at the right time, in the right way, or it won't support what the device is doing. In fact, if you get the timing wrong, you could be wasting months of effort seeing no results at all. So listen closely to what I'm about to explain. The device creates the physical stretch. The drink floods your system with exactly what your tissue needs to respond. And together, that's when you see more than 3/4 of an inch of real growth. There are 3 non-surgical options that have been studied. 3. And only one of them actually works. The first is vacuum devices. You've probably seen ads for these. They create suction, pull blood into the tissue, and claim to add length. But when researchers measured the results, there was no increase in length at all. 0. It might give you a temporary pump, but that fades within minutes. No lasting change. The second option is injectable treatments. And I need to warn you about this because the complications can be devastating. Men have injected everything from silicone to other substances into their tissue, and the results can show up decades later. Scar tissue, lumps, deformities, loss of function. Some men need reconstructive surgery to fix what the injections destroyed. Do not inject anything into your penis, ever. The third option is penile traction devices, and this is the one that actually works. These devices apply gentle, consistent mechanical stretch over time. You wear them for several hours a day, and they signal your body to build new tissue in response to that stretch. When researchers tracked men who used these devices religiously for months, they measured real growth, about 2 centimeters, more than 3/4 of an inch. That's measurable, that's real. But here's what changed everything when I learned this in class. This only works consistently when you combine it with something that increases blood flow from the inside. The device creates the stretch, but your body needs the right fuel to actually build new tissue in response. Without both working together, you're spending months wearing this device and seeing minimal results. Maybe nothing at all. The device pulls, but your body needs circulation, nutrients, the building blocks to respond to that pull. And that's where the drink comes in that I'm going to show you how to make. Because when you flood your system with what your tissue actually needs while the device is doing its work, that's when you see the full effect. That's when more than 3/4 of an inch becomes possible. Now here's the recipe I promised you. It's called the Natural Energy Mix, and I designed it specifically to support blood flow and tissue building while you're using the traction device. The ingredients are simple but powerful. Egg for B vitamins and testosterone support, honey for circulation, cinnamon to boost blood flow and sensitivity, almonds for arginine, which improves blood vessel function, lemon juice for vitamin C and circulation, ginger to stimulate blood flow, and pear juice for antioxidants and hormonal balance. Every single ingredient has a purpose. Here's how you use it. You drink this in the morning, about 30 minutes before you start wearing the traction device. The nutrients flood your system, open up your blood vessels, and prepare your tissue to respond to the mechanical stretch. Your body needs this fuel to build new tissue. Without it, the device is working harder for less result. Now let me show you how to make it. Crack 1 egg into a bowl and whisk it smooth. Add 2 teaspoons of honey and mix until it dissolves completely. Grate in some cinnamon, then crush 5 almonds and add them. Squeeze in the juice from a small lemon slice. Cut a small piece of ginger into cubes and add it. Grate a ripe pear through a fine strainer to get just the juice. Then add that. Mix everything together and let it sit covered for 10 to 15 minutes. Strain it into a mug and add warm water. Not hot, just warm. Comment below if you want me to send you a video of me actually making this recipe with more detailed instructions. Since I'm still in training, I'm learning all of this alongside you. So if you have questions about men's health or topics you want me to explore, drop them in the comments. And please, if this video helped you, hit that like button and leave me a comment. Every single one makes me so happy and gives me confidence to keep making these videos for you. Every question helps me grow as a doctor and helps me create content that actually matters to you.